Hi, everyone. I'm Cassie Goodman. I'm the Cancer Early Detection Programs Manager at Nevada Cancer Coalition. And today I'm here with Liz Partida, a Cancer Care Coordinator at Community Health Alliance. And she's going to be talking to us about FIT kits and their role for screening for colorectal cancer. So thanks for being here, Liz.
Thank you for having me. It's a pleasure.
So Liz, a lot of people have heard of a colonoscopy and that it can be used for screening and prevention of colorectal cancer, but there are other tools out there to screen for this type of cancer. So what is a FIT kit?
A FIT kit stands for fecal immunochemical test. It is the test for colon cancer. It detects blood in the stool. So it's a yearly screening exam.
Yearly screening to check for blood in the stool.
Mhm.
Let's say I get a FIT kit. What can I expect to do with that? How do I complete one?
Usually every FIT kit comes with their own instructions, um, but basically it'll just ask you to collect a stool sample. Once you collect the stool sample, it either gives you a card or a tube. You put a piece of your stool sample in either the card or the tube. You can send it out to the lab and it detects for blood in the stool. So each one comes with their own directions, but that's basically what you do.
Great. So I'm doing this at my own home.
Yes. So it's an at-home test. You could do it at the comfort of your home and you receive it, do it at home, and you can send it by mail.
Oh, that's great. Pretty easy. So you already said if I'm having normal findings, I can expect to do this test once a year. What happens if my test finds something?
So with normal testing, it's once every year. If it's abnormal, if it does come out back positive, which means blood in the stool, we do refer you, as in your primary care provider, refer you to a GI for a colonoscopy.
Okay, so abnormal finding, I would go in for that colonoscopy. And I bet it's pretty important to schedule that colonoscopy as soon as possible.
Yes, correct. So as soon as you get your positive fit test, we do want you to go to get a colonoscopy.
What if I've had cancer in the past? Can I still do a FIT kit?
For survivors of colon cancer, you will be referred straight to GI where you can get your colonoscopy completed.
Okay, great. So at what age should I talk to my provider about getting this kit?
It is best to discuss this with your primary care provider, but screening for average risk patients usually starts at 50, although there is some discussion to switching that age to 45.
Right. So the sooner the better. And then how can I get a FIT kit?
You can receive the fit kit from your primary care provider. Usually you will receive the kit in office or be given a lab order where you can receive it in the lab.
Great. Well, it sounds like a pretty easy at-home test to screen for colorectal cancer, which is always an important thing to do. So thank you for being here, Liz, and telling us all about this great at-home screening test.
Of course, it was a pleasure.